What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, March 18th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. We're going to talk about one of those other viruses today, actually two of them, potentially. So if you want to stay informed, be up to date with what's going on, by all means, subscribe to my channel down below. If you like this content, give it a thumbs up. Want to help keep other people safe? There's a really easy way to do that. Hit that share button down below and share this with anyone you know. You know, word of mouth really does go a long way. All right, I got my notes with me today. We're out in the wild. You notice I had my mask on. Yes, you still need the mask. I decided, well, we're in the middle of the update here. We'll take it off for now, but it's got to come back on later on. Second I get out of this vehicle, back on it goes. All right, starting off with some notes. First thing, just a real simple thing. Then we're actually going to read an excerpt from an article that I shared on Twitter this morning, which I find is rather interesting. Remember, today is March 18th. Keep that in mind. Remember that date. Yesterday, which was March 17th, Philadelphia had 669 EMS incidents. Some of the lowest, that's one of the lowest days since the start of the pandemic. Really good thing. I hope we continue to see more days like that. All right. Remember I just said, remember March 18th? Here's why. In Wisconsin, get this, in Wisconsin, Crandon schools extend closure after mystery illness. Now, I don't know when precisely their closure actually started, but the point is, this closure, it's going to last for a really long time. Let's read why. Following an outbreak of a mysterious illness affecting dozens of individuals, Crandon schools have decided to extend their closure for another 2 weeks. Well, what's in 2 weeks? That takes you all the way to Tuesday, April 2nd. Yeah, that's a really long time. Today's March 18th. They're not going to reopen until April 2nd. Well, one of the things is because spring break's coming for them. Another of the issue is there's a lot of people sick. Let's continue on. The decision comes after 10 students and teachers reported feeling unwell, prompting the involvement of the Forest County Sheriff's Office. Don't ask me why they had to involve the Sheriff's Office for illness. That makes no sense to me. Maybe it's just the way they do things out there. I honestly don't know. By the end of the day, the number of affected individuals had risen to 39. Ooh, that's a big increase. In response, Crandon schools have opted to prolong their spring break by 1 week, utilizing this time to thoroughly inspect and sanitize their facilities. Students are expected to return to the school on Tuesday, April 2nd. Okay, you can sanitize, that's fine. You got any extra money laying around? Do you? I'm talking to the school district here. Why not invest in some air purifiers? And when the kids come back, N95 or better masking. Even KN95. Just mask. Put a masking policy in. Put some HEPA filters in. That would help if it's a viral infection, an airborne. Could it be norovirus or something else? Yes, that's possible too. But if it's something that's airborne, guess what? Mask. They're really effective. They really do work. All right, moving on to this. It is Monday. That means the weekly BNO update, and I got that on here on my notes. Weekly U.S. COVID update. New cases, 126,170. We know that's an undercount, but hey, they are continuing to come down. The average is 158,945. That's down by 23,000. States reporting, 50 out of 50. In the hospital, 13,298. That's down by 1,000. In the ICU, 1,603. That's down by 242. New deaths, unfortunately, still 1,311, but hey, that is down quite a bit. The average is 1,548, and these are COVID deaths. Remember, this is all COVID right here, not influenza. We'll get to that in a moment. But the average is 1,548, down by 124. Then you have to add the new deaths, 1,311, to the number of influenza deaths, which we actually don't have an accurate count this week because it's dropped quite a bit. This is some good news. New cases, still estimated to be 1 million. That's not good. The average is 1,250,000. That's down by 250,000. Hospital admissions for influenza, 10,000 influenza admissions. And new deaths, it shows here, and I'll show it to you, under 1,000. So that is some really good news to see that new deaths are under 1,000. So let's just say the new deaths were, I don't know, 700. Well, if they were 700, that would mean we had 2,011 deaths in the past week just between COVID and influenza. Or if it is right around 1,000, it's just over 2,300 deaths in the past week. So those numbers are dropping, but they are still far too high. That does it for my notes. Now I have something else to talk about that I've read several articles about over the past couple days. I've heard the New York Post has done it. I've seen a bunch of random sites do it. And what I'm referring to is something that is very disturbing to me. Something that definitely should not be happening, considering we are just coming off of last Friday, which was International Long COVID Awareness Day. Several news agencies have come up with the idea. Apparently there was a new study. I didn't see the actual study, but I saw what the articles put. That's good enough for me. There's several news agencies that are saying it's not proper to call post-COVID illness long COVID anymore. We shouldn't be saying the word long COVID anymore because we now know there's long flu. Okay, well, if we know that there's long flu and you're calling it long flu, why can't we say long COVID for long COVID? For people who have post-COVID issues. Anyone who has a new health issue post-infection from getting an acute case of COVID, guess what? Even if it may be minor or maybe something that's very significant, my friends, it's called long COVID. I don't care what these news stories try to say. Some of them are Republican. I don't like to get political on the channel, but let's face it, this pandemic several times has been politicized. This pandemic, keyword, pandemic, has been politicized far too long since the start of this whole thing. And here we go again. We have to pair it up or match it up with all the other viruses because that's what they want to do. It's totally ridiculous. If you have post-COVID symptoms that last for multiple weeks or new symptoms that happen, like heart palpitations, brain issues, diabetes, anything that you did not have before COVID, guess what? Number one, it's because of COVID. Number two, it's a form of long COVID. We will not sit here and try and call it something else. That is just totally absurd and ridiculous. Repeating, post-COVID issues that arise, new issues that arise, post-COVID infection is called long COVID. If you have post-flu issues from flu, then yes, it is correct to say long flu. But we can't just try and hide the word COVID because we want it to be over with, or, oh, COVID, I lost so much time of my life to COVID. I'm never going to let that happen again. I'm going to go out and live my best life. I'm going to dine indoors and do this and do that every day because you know what? That freedom, that time I lost from my life, I will never get that back. Blah, blah, blah. They may take our freedoms away again. No, they weren't trying to take your freedoms away. They're trying to keep you safe from a virus that does brain damage, heart problems. It can damage any portion of your body. There are people who were perfectly healthy, got one COVID infection, now they're in a wheelchair. That's real. That's long COVID. So we can't just keep downplaying long COVID and trying to minimize and trying to forget it exists, because it exists and it's here to stay because we choose to do nothing about this virus. Okay? Get where I'm coming from? Until we decide to do something about this virus, long COVID is going to be a thing. For as long as people are getting infected with COVID, there will be people that go on to develop long COVID because we have no cure. There's no rhyme or reason as to why it happens. I mean, some people get it, some people don't. Some people get COVID that aren't vaccinated, end up perfectly fine. Then you have people who are vaccinated for COVID, and they end up going on to develop long COVID. And the same thing happens with unvaccinated. There's unvaccinated that go on to develop long COVID. There's all types of situations. Maybe someone didn't get the booster. Maybe someone did get the booster. It happens. We don't know why it happens. We need to go out and find out why it happens. And the one thing that is preventing us from doing that is doing these idiotic stories, publishing in the news that, oh, well, we shouldn't be using the phrase long COVID anymore. It's time to just normalize it. No, it's not time to normalize it. It's time to do something about it, because the time is now. The longer we wait, the more we're going to be hurting ourselves. We're going to be paying for this down the line, because so many people are going to have long COVID that, guess what? Society is going to have a complete breakdown. Society is going to have an economic disaster, because so many people will be too ill to patronize in these restaurants, to deliver your packages, to do all these things that help the basics of life function. Why? Because we try to minimize long COVID. Okay? That's my rant for today. That's today's pandemic update. We'll have another pandemic update in the near future. If you like these videos, give them a thumbs up. If you just learned anything, subscribe down below, such as long COVID. There's 150 to 200 different symptoms of long COVID. You might want to remember that. You could get any one of them after a COVID case. It could randomly be you. Don't let yourself be the next victim. Wear a mask. Alrighty, subscribe if you like this. Share this with anyone you know. The more people we share these videos with, the more people we help keep informed and safe. Have a fantastic Monday afternoon. See you all again next time. Thanks for watching.